Again, my name is Jamie Tudeberg. I'm with the Healthcare Authority, and I'm currently the program manager for the Family Planning Only program. And I'm going to have the room go ahead and introduce.
Hi, this is Melissa Rivera. I'm with the Medicaid Eligibility and Policy.
All right. We're going to go ahead and jump right in. We will be utilizing the question box throughout the webinar, so if at any time you have any questions, comments, please feel free to put them into the question. We will be pulling questions out of the webinar, out of the question box, at the end of the webinar and answering as many of them as we can. After the webinar today, we will be taking the questions from the question box and providing written answers. And those will be sent to all webinar participants as well as anyone who signed up for the webinar as well. Additionally, I should share that this webinar is being recorded. So if at any time you need to go back and revisit this information, or you'd like to share it with others that you work with, please feel free to do that. Again, the recording of the webinar will be shared when we send out the questions and answers. The last thing I'd like to call your attention to today is on your GoToWebinar dashboard. You will also see a category. It's most likely right underneath the questions box. It's called Handouts, and there are two handouts there. The first handout that you will see is the slide deck with all the slides that are being presented today, and the second handout is the draft application, and we will talk more about that as we move forward. So just wanted to call your attention to that. So again, thank you so much for taking your time this morning to join us. We're going to go ahead and jump right in. We're first going to start with just a real brief overview. There have been a number of changes to the program starting back in July, and now we are embarking upon another change here in January. So not too much time in between those changes. And we wanted to make sure everyone was up to speed and had all of that information. So we have a few family planning programs. The first one I'm going to talk about is Family Planning Only Pregnancy Related. It formerly was known as Family Planning Only Extension, and sometimes folks refer to it as Family Planning Only. So moving forward, as of July 1st, 2019, we call it Family Planning Only Pregnancy Related. This program serves recently pregnant clients who lose Apple Health coverage after their 60-day post-pregnancy coverage ends. A client must have received Apple Health coverage for their pregnancy in order to be eligible for the Family Planning Pregnancy-Related program. I call special attention to that because sometimes clients move into the state shortly after giving birth, and it would seem logical to put those clients into Family Planning Only Pregnancy Related if they weren't eligible for full scope Apple Health. But actually they don't qualify if they haven't received Apple Health during their pregnancy. They instead would be eligible for our second program, which is called Family Planning Only, formerly known as Take Charge. This program serves uninsured women and men seeking to prevent unintended pregnancy. Additionally, it serves teens and domestic violence victims who need confidential family planning services. Okay, I'm going to stop really quick. I just got another message saying people cannot hear me. I apologize. So give me one moment while I figure that out. Are you muted? No, we should be on the call. If you can hear me, can you please go ahead and raise your hand? Okay, now I've got all sorts of comments that say you can't hear me. So if you can't hear me, well, I guess that doesn't matter if I'm saying this out loud because you can't hear me. Give me a moment while I reply to this person. Yeah. Okay. Thank you for bearing with us. All right, moving right along. This is a review of our July 1 changes. So as of July 1st, 2019, for the family planning only programs, a client can now seek family planning services through any Apple Health provider. And what that means, or what the change is for those of you who maybe are joining us today and aren't sure where this is coming from, is prior to July 1, the program called Take Charge, so the family planning only program, those clients were only able to see Take Charge providers. So there was a certain set of providers who provided those services. And as of July 1st, we have opened it up to all Apple Health providers within their scope of care can provide the family planning only services. Another change that happened in July was we eased enrollment, made it easier for clients. So again, when the program was called Take Charge, clients needed to apply in person with their Take Charge provider. And when the provider piece changed, we also changed enrollment, which means clients, for family planning only, clients who were once upon a time applying in person, are now able to apply in person, by mail, by phone, by fax, and by email. Those folks who are on family planning only pregnancy related or potentially eligible for that, clients, as it says here, received Apple Health pregnancy medical coverage, are then automatically enrolled when their pregnancy medical coverage ends during the 60-day or after the 60-day postpartum period. So it's an automatic enrollment into the pregnancy-related program if the client is not eligible for full scope Apple Health. This is a very quick, high-level snapshot of what benefits are offered to family planning only clients. More details around this is in the Family Planning Billing Guide, which can be accessed from our agency's website. So I'm not going to read all these to you, but I want to share with you the really important message here is that all of the family planning programs that we're talking about today, family planning only pregnancy related, the formerly known as Take Charge program, and the new one that I'm about to talk to, all the clients are eligible to receive all of the same benefits. So it's really important just to keep that in mind as we continue to move forward. So the exciting piece, which is why I think so many of you have joined us today, is to hear and learn about the expansion that's happening effective January 1, 2020. So in just less than a month, which is crazy, we will be expanding the family planning only program. So again, remember, to the client, it looks exactly the same in terms of what benefits are offered, who the client can see, and how they apply to this population as well. So all individuals at or below 260% of the federal poverty level who are Washingtonians, regardless of their legal status, are eligible for the family planning only program. It is important, again, to note that the family planning only programs are only for clients who have no credible medical coverage. So if a client has coverage through a spouse, a partner, has their own employer insurance, but the deductible is high or something else, they are not eligible for family planning only. This is one of the requirements of the program. This change will go into effect as of January 1, 2020, as I mentioned. Again, clients who are eligible for this program will be allowed to also apply in the same way, in person, on the phone, through email, through mail, and fax. There is more information about this, not only on the application itself, but also the contact information for this is in our billing guide, as well as it will be updated on our website soon. And as I've already mentioned, the benefit service package will be the same. So again, as I mentioned at the very beginning, the full application is attached in the email or in the appointment that you have on your dashboard. This is just a snapshot of the first section, and we just kind of wanted to walk through what are some of the changes, where we were going with this. And before I talk about any of the bullets, I want to share with everybody that, especially those of you who have been around for a little while and know and understand, or at least have knowledge of the Take Charge program. So when the Healthcare Authority was approved for the Take Charge program to continue moving forward as of May of 2018, so an extension for 5 more years of the federal dollars to fund family planning only, there were certain stipulations that we had to agree to. Some of them we've already discussed. So that was increased provider access, increased ease of enrollment, and here is an example of another one. When we made some of those changes, we looked hard and long at our current application that you could find on our website today, and there are a number of things that aren't captured on the current application that's up there today. So we had to go through the application, and we've been working on the application since April. We are getting very close, but I just wanted to share with you that this is what we have right now. One of the things that we worked really hard with is we worked with our communications division to ensure that we have a new improved layout, which is also ADA friendly. The questions are aligned with the Apple Health application, the 18001 application that is. We've now built in some instructions as we go through. So if you see the box that has the yellow highlight, it tells and instructs clients, providers, navigators, whoever might be helping the client if they're there in person, which part they can stop, when they can stop, and where they should move to next. So we've tried to build some of those pieces in for ease. And one of the pieces I really want to emphasize and share with everyone who's on the phone today is this section that you see right now, which is section number 1, the applicant and contact information, is very, very important. We have to have this filled out to the best of the client's knowledge, as much of it as possible. With that said, as I've already mentioned, the new expansion that's going into effect as of January 1 expands into clientele regardless of their legal status. And so knowing that, we know that not everybody who will be applying has a Social Security number due to their legal status. So if you encounter a client who would like to apply, meets the qualifications, does not have a Social Security number, that's okay. You can leave that blank. If, however, a client has a Social Security number, it is really helpful to us and important to have that on there. So I wanted to share that with you. The application, this version of the application, will be available starting on Monday. I don't know exactly what time on Monday, but sometime on Monday, our goal is to make sure that the application is available. And we'll talk a little bit more about that in just a moment. I've already called to attention the yellow highlight, but I wanted to share with you the reason for the red arrow that you see, and that is where we're showing that we have aligned questions with the Apple Health application. I'm going to pause there for just a moment, and we are going to go ahead and do a poll. So before I launch the poll, I want to share with you the following. Considering the application, even the snippet that you just saw today, and considering your experience with the program and with clients, in your experience, would you like to see a cover sheet that goes along with the application for additional guidance for both the provider, the navigator, folks, as well as the client? Or the other choice is no, the application and its directions that are on there are sufficient enough. So please go ahead, take a moment to think about that. The poll should be popping up now. And once you answer the question, if you answer the question, yes, clients, providers, navigators, etc., would indeed benefit, please take this opportunity, and we're going to pause here for just a moment, but please take the opportunity to then provide some input on what kind of cover sheet, what kind of additional instructions and guidance would you find helpful. So if you have questions when you look at it and you go, oh, I wonder what they mean by this, please go ahead and put those kinds of things into the question box. About 50% have voted so far. And I'm going to give everyone about 1 more minute. If you have input as to what you would like that guidance document to look like, please go ahead and insert that into the question box now. I'm going to go ahead and close the poll. We've got about 85% of you participate. Thank you for that. I'm going to show you the poll results now. You should be seeing those. So as you can see, 54% say yes, and 46% say no, it's sufficient. So we've asked this question a number of times to a number of different audiences. Today's audience includes providers, navigators, stakeholder groups, etc. And so again, the answer to this poll has been split very similarly to this group that's on the phone today. I appreciate that. So again, go ahead and take a moment if you answered yes to give us something to help create this cover sheet. Okay, thank you. You have filled the question box. It's not full yet, so please keep sending those ideas in. It's very, very helpful for us. But we're going to go ahead and move on. So now you should be seeing a new screen, and you do. So the new application and program implementation. So as I've already mentioned, our plan is to release the application on Monday. Please know that we have received some feedback about the application, and there may be some changes that will happen to the application, but they will not be able to happen before Monday because the application has to go through our design staff and then back to translation with any changes that we are able to make. Okay? Clients may start applying for the program as of Monday. So as soon as you see the application, if you have clients in the clinic that you'd like to reach out to, you certainly may. They may certainly fill out the application and send it in. Our staff here who work the applications are working on a process. They've been trained and will be trained on the new processes as well to make sure that everyone is on the same page, that anybody who is now in this new eligible group, the expanded group, they may start applying on Monday, but they will not be able to receive services until January 1st, 2020. So we've done everything we can to make sure that folks can have the application early and have the opportunity to start receiving services as close to the beginning of the year as possible. Other pieces of information I want to share with you. Anybody who received this invitation today, who also may receive receives the provider alerts from the healthcare authority, there will be a communication that's coming out on Monday. Within that communication, it will share a number of the same information that you already heard today. It will share where the application can be found. It will reiterate who the population is that we serve with these programs, and it will reiterate that the new eligible group, so the clients who are not previously eligible for family planning only due to legal status, may now be eligible to receive benefits as of January 1st in the family planning only world. So that communication is set to go out on Monday, and we are working quickly with our communications folks to make sure that they are ready for that. We've been working with our team that works the eligibility side and the applications to make sure that they are all set and ready to go. If you have questions about that or what that looks like, please feel free to let us know. One question that we did receive yesterday from our training, which was an in-house training, was around what will folks see in Provider One when they are billing or they're checking the status of their clients. And right now, as you know, the Family Planning Only program still has TC as the beginning of the code. It says TCFPO, as I recall from the top of my head. And I want you to know that because the benefit service package is exactly the same, it will say that same thing. It will say TCFPO. So again, that's what you'll see from your end in Provider One when you are going to bill a claim. Claims will go through the same way that they have been going through for our family planning only clients. Melissa, is there anything I missed that you want to add in there?
No, I think you got it covered.
Okay. That is the end of our formal presentation, but I'm going to go ahead and open up the question box, and we will answer some questions here today. Please feel free to disconnect if you need to, but again, you're more than welcome to stay on, but know that all of the questions that are in the question box will be answered for you. We will not be able to read all of these questions out. We just won't be able to read them all out loud. So give me just a moment while I take a look. And some of these questions I'm going to read, and I'm going to have Melissa go ahead and answer. That's a surprise for Melissa. Okay, so Melissa, we have one question that says, will Healthcare Authority be able to access Social Security numbers from a client's previous application, like when they were under 18?
We would have access, but we would rather you provide a Social Security number if you have it. We don't want to assume that the Social Security number belongs to this individual that only provides their first name and last name. So if you have a Social Security number, I think it would be beneficial and probably a faster process if you go ahead and put the Social Security number in the appropriate fill-in box.
Right. Good. Thank you. So another question. I'm just trying to make sure I can read them. They're kind of smushed together. So another question comes in and says, are Washington residents who have private insurance coverage or other coverage eligible if they are seeking confidential services? That is a really great question. If a client is on a partner's insurance or a teen is on their parents' insurance and they are seeking confidential services either because they are a teenager or because they are a domestic violence victim, but they have coverage again through their parents or through their partner who is abusing them. So they're two different groups. I don't want to confuse you even more. Yes, those clients are eligible to apply. So that is the only exception to the rule of you can't have any coverage when applying for or being eligible for family planning only. Good questions. So there's another question that says, will applications be rejected if clients do not complete the question about citizenship? The application will not be rejected, but we will not be able to accept the application until we know the answer to that. And that is due to, we need to be able to know here at Healthcare Authority behind the scenes, we need to be able to assign the client either into the federal program, family planning only program for federal funding, or we are appropriating that client into the state-funded family planning only client. So it's really important that we have the citizenship question as well as the lawfully present question answered. And the reason that they're both on there is because currently the family planning only program is, the federal funded one, is available to United States citizens as well as qualified immigrants. So those would be folks who are lawfully present. So that is why those questions are on there, and they are worded exactly the same as the 18001 application for consistency of messaging. So it's not that the application would be rejected, but it will take additional time before the client's application would be approved. It will take one of our folks who process the application to be able to reach out to the client and hear back from the client. So while we're talking about our staff here reaching out to clients to get additional information for the application if there are blanks, and they might be blanks, then we can't process the application. It's also come to our attention most recently that there are some applications coming in with very limited information. Limited information so much that we're not able to contact the client. So there's not a phone number, there's not an email address, and there's not an address. So there have been a handful of those applications that have come in, and it's really important that the client has some mode of communication on there so that we can reach out to them to say, hey, we have your application, we want to go ahead and process it, but we can't contact them if we don't have any contact information. So those of you who are on the phone who are providers, navigators, etc., who are helping clients apply, please make sure that you encourage clients to put contact information on there. All right, so there are a lot of really great ideas in here for a cover sheet. I'm just going to read off of a couple. There are several of you who've written in that said idea for a cover sheet would be to include information so that someone who does not have a Social Security number, the provider, navigator, etc., as well as the client knows that it's okay for them to still apply. So that's a great suggestion. So thank you so much for that. Others of you suggested having some type of image or picture to describe the process. So again, very great idea. Thank you so much. There is a question in the box that asks about household members for the income portion. So if someone's applying for confidential services, right, then their household is a size of 1. If somebody is applying for, they're part of a non-confidential group of folks, then their household needs to be the number of people in which they have on their income taxes.
Yes, it would still apply if they're applying for full scope medical. The income rule still applies. So if you're not seeking confidential services and it's you and you have a family, we would consider the entire family, 1, 2, 3 persons in the household, as well as the income. So, but again, if they're seeking confidential services, we would only count them as 1, and if they have income, we would only look at their income.
Yeah. Other questions have come in, or not questions, but really comments around that clients would benefit from understanding what they can expect after they apply. So after a client applies, they either get an approval
letter, right?
Or a denial letter.
Yep.
Or they get contacted saying, we need more information. So those are really the three tracks in which application goes down. Either the application is approved outright, client is contacted, the application is denied outright, the client is contacted, we need more information, the client is contacted. So it's important to know that all clients will be contacted in some way, shape, or form. Again, that's another really great reason why it's important to have an address for the client on the application so that they can receive their approval letter, hopefully, or their denial letter, or their request for additional information. We do have a dedicated team here at the Healthcare Authority that this is their job to know and understand this program and to process these applications, to process them quickly. So they receive the applications when they are faxed, mailed, emailed, etc. They also are the same team who receives the phone calls as well to process the applications. So I just want you to know that it is a dedicated team. It doesn't just get bounced around if you called in or a client called in about them, because the folks who are doing this are trained on it. So that's hopefully helpful. I'm just reading real quickly here, high level, the other questions that are in here. Another question is, how long does it take to determine eligibility once the application is submitted? That varies depending on volume. Is the fastest answer I can give.
Yeah.
What I can say is we were asked that question recently by CMS when we were discussing the application earlier in the fall. And they asked that question, so we were able to pull some data. And the oldest application that was in the queue was approximately 48 hours old. And that was a Thursday evening it came in, and we were having this discussion at 8 a.m. on Monday. So it's important to note that they move in and out quickly. We don't want folks not getting benefits because applications are just sitting here. It may feel a little bit longer of a process when folks, regardless of their legal status, so those who have not been eligible for, if they start applying here the last 2 weeks of December, it may, if we get inundated with applications, that may be a little bit longer than 48 hours. I can't guarantee anything on that piece, but that's important to note. The other piece that's important here, I'm not sure that we said this already, is we worked hard to streamline this to make sure that this is the same application that can be used for all family planning only programs. So again, clients do not apply for the family planning only pregnancy related program, but the other family planning only programs, the state funded and the federal funded, it will be the same application. It's streamlined so that providers, navigators, and clients don't need to determine which application clients need to pick up and use. And we did that for a number of reasons, but one, like I said, is to not have to worry about the determination. And the second one is if a client pulls the application online by themselves, which a number of clients have, if there are two options, then if a client filled out the wrong one and we needed to contact them to say, hey, we need you now to fill out the other one, it would just be, again, a delay of benefits to the client. So again, trying to make sure that we are as streamlined as possible. Great, another idea that came into the box for a cover sheet is to have, for the client, is to see what services are covered by this program. That's a really great idea. It's also good to note on that piece that there is a client side. There's a client website, I should say, with client level information around the family planning only programs, as well as a provider website. So there's two different websites housed here at Healthcare Authority. The application is going to be available on both. And so I call that to your attention. If that's not something that you were already aware of, then please feel free to let us know that, and we'll make sure that we include the hyperlinks to both websites inside of our follow-up communication with you. So again, some really great questions. There's another question that asks what languages or will the application be translated? Yes, the application will be available in English as well as in, I believe, 14 or 15 other languages. So it's in all the languages that the full Apple Health application is available in. So that is very exciting. I'm still just kind of weeding through the questions that are here. Great, lots of really great ideas. There's a suggestion for income guidelines would be helpful for clients to know, etc.
That's a good idea.
Again, another idea of a cover sheet, including some questions and answers, including Social Security number piece, processes piece, as well as U.S. citizenship and what that all means to the client from a client level piece.
FIQ, that's a good idea.
So that's a really great idea. Contact information, so please include contact information for folks who may need to follow up but don't hear back about their application eligibility. And so I can give you that input right now that yes, of course, if we put a cover sheet on, we would definitely reiterate a phone number and other contact information on there. It's the same phone number that is on the application draft that you see in your handouts right now. That's the number that folks would call. So if you're wanting, that's top of your mind right now and you want to jot that down, feel free to do that. So there's another really great question about the expectation. How often are the clients needing to reapply to seek the same services? So I'm not 100% sure that I am understanding this question, but I just want to make sure folks know that when someone is approved for the Family Planning Only program, it is a 1-year, 12-month approval. And near the end of that, clients are then, if they are not eligible for full scope Apple Health at that time and wish to continue with Family Planning Only, they are welcome to apply again and again and again. So,
and that approval letter, once they're approved, will also tell them the dates that they're approved from. So if they're approved starting January 1st, 2020, that letter will say you're approved as of January 1st, 2020 through the end of 12/31/2020. And then usually right before the end of that period of December, they'll get another letter reminding them that it's time to they can reapply for family planning, or if they want to go and apply for full scope medical, they can do that, and it'll be another reminder letter.
Yeah, and that's a good piece around the letters. So anybody who applies for full scope Apple Health, if the client is denied Apple Health, on their denial letter, and this change just went into effect in October, if they're denied Apple Health, on their denial letter, it says something to the effect of, again, paraphrasing, I don't have it in front of me, I apologize, but on the denial letter to the client, it says you may be eligible to receive family planning only, and directs them where to apply. So folks are already receiving that letter, and that will continue to be true. Okay, there's another question in the box that says, is there a time frame between when the application is completed and when services start?
Is there a time frame?
So if an applicant completes the application and sends it in, the application has to be approved before services can start.
Correct.
And if I have skipped over your question, it is not purposefully. There are lots and lots of questions, so I'm just trying to scan through them and answer as many of these as I can. So there's another question around additional outreach. So if anybody has suggestions for additional outreach, we would love to hear them. There will be a front and back one-pager, which will come with the communications blast, which goes out to providers through our provider alerts. And on that PDF or that one-pager that is sent, it depicts the different programs underneath the family planning only program, who is eligible, and if the application or the entrance into the program is automatic, or if they must apply and how often must they apply, as well as some of the program highlights. So there's that piece. We released something very similar in June in preparation for July, and we encouraged folks that we talked to at that point during those webinars to print that out so that they could spread it and share it with their office staff, their navigators within their organizations, as well as providers. So there's that piece. Okay, so another question talks about, will individuals being terminated from a 60-day postpartum coverage be offered family planning only before their coverage termination?
So it's an automatic, right? So if an individual was pregnant and they were getting pregnancy medical and the baby is born, they will get that additional 3 months of coverage. And then once the end of the third month ends, the family planning services would be an automatic, so they don't have to apply. It just, the following month, the program would change from family planning medical to family planning services only.
Good, thanks, Melissa. Okay, another really great question. Can men also be covered for family planning care, example of vasectomy, procedure, or other things? So absolutely. The program is for all genders, which is fantastic. Family planning only covers sterilizations for all people who wish to have one. Please note that there are rules around the sterilizations, and that includes signing paperwork with the provider who's going to do the sterilization, and then a 30-day wait period. That's a federal rule. And then the client has between day 31 and day 180 from when that paper was signed, saying they wish to have a sterilization in which the sterilization can occur. So yes, absolutely, men are covered. They are covered not only for vasectomies, but also for any type of contraception that they might be eligible for, such as condoms is what comes to the top of my head, but also they are eligible to receive STI screening and treatment. So absolutely, this is definitely not a program that is gender specific, though I can say that after reading the last set of reports, we definitely have many, many, many more women than we have men utilizing the program. So absolutely, it is definitely something that should be shared with all clients who may be eligible. Another clarification just came in recently that says if a client has commercial insurance, but their benefits do not cover contraceptives, can they apply? And that answer is unfortunately no, because the terms of this program are if you have credible coverage, you are not eligible for this program. So, really great question. That is a question that we get frequently. And that question has repeated itself a number of times in our question box. So I will make sure that that question in particular goes up on our website for both clients and providers, just to make sure that, you know, that information is out there. Okay. Great. There's another question that asks about what kind of documents do residents need to provide with their application. So when somebody fills out the family planning only application, they just follow through the instructions and they are instructed. If they are not a resident of the United States, it says on there that their immigration documents should be submitted if they have them. As far as United States residents, they don't need to send in anything. They are testing at the very end of the application that everything that they have said is true. Everyone is attesting that everything they have said on their application is true, but there's no additional documentation.
No, we just want to make sure that if they do attest to being a citizen or lawfully, present, that the Social Security number is provided, just so that we know that it can be verified behind the scenes.
Great. We've been asked a couple times now in the box, is the new application that you're seeing today, is that something that we can use for both programs starting on Monday? Yes, absolutely. We will definitely have a transition period. We're not going to say as of Monday, December 16th, you're no longer allowed to use the one that you've been using. We always know there needs to be some transition period. We'll make sure that a message gets sent out about that. It would be our advice not to make that a practice to keep that old one around for too long, because it does say on there that if you are not a legal citizen, then you are not eligible for the program. So, you know, we don't want to send that message because, of course, we are allowing everyone. Okay.
Good question.
Absolutely. And there's been additional questions around the languages that it's being translated into. As I mentioned before, but some folks may have missed it. Yes, the application is going through translation and it is being translated into, I believe, 13, thank you, 13 languages, the same languages that the full Apple Health 18001 application is translated into, just like the other applications that we have here. Okay. There has been a question around who do we share this information with?
No one.
No one. We don't share this information with anybody. So I hope that that helps. So we are not sharing applications with the feds or any other state agencies. Okay, there's been a comment to make sure we list out the types of contraceptives as well as family planning services on our cover sheet or somewhere. So absolutely, I think that goes into beautifully with what services are covered and who is covered. So it sounds like what might be helpful isn't necessarily an additional instruction sheet, so there might be room for that, but also to have kind of a cover sheet that shares a little bit more about the program. So absolutely, that sounds fantastic. So there is a question that says, can a provider's office pre-fill the AREP section with provider address, phone, if applicant initials the section.
I mean, I don't see why not, but we just want to make sure that that is something that the client wants. We just don't want them to make it a practice, though, that because it's on there prior to the clients applying, that they forget and are not asking if the client would like to have them as an ARIP. So I think you can you might want to be careful with that, because you know how you get going to the same practice, and then before you know it, what if you're not asking the clients for the request to be an ARIP? So I would just be very careful and just make sure that you ask the client if that is what they want, and if they want to initial it, that's fine. It should be okay.
Thank you. Okay, another question is, will children losing Apple Health at age 19 due to immigration status be transitioned to family planning only?
They would need to apply, though.
Yep,
So,
it's not an automatic piece. The only automatic is those who are on pregnancy medical will automatically, and that's currently happening today, automatically onto family planning only, pregnancy related.
Yeah, but if you're 18 and you turn 19 and your Apple Health ends and you are interested in the family planning services, yeah, you would just need to apply for that service.
Another question is, how long is the family planning only pregnancy related coverage for? So a client, the pregnancy ends, and it's irregardless of how the pregnancy ends. So it could be a miscarriage, it could be the birth of a child, it could be an abortion. Regardless of how a pregnancy ends, that client is still on pregnancy medical 60 days postpartum. And it's a little bit more complicated than 60 straight days, because it's actually the last day of the month in which that 60th day postpartum occurs. So some clients receive that coverage for what looks like on the calendar 3 months, and some receive it for 2 months. It truly depends on when the pregnancy ends. When the pregnancy ends and that 60-day window is determined, and that's determined client by client by client, and that is not a definition we came up with here. Again, that's a federal definition that we have to follow right now. When that is determined, when their family planning only pregnancy related services will end, that ends when it would be approximately 1 year after they've given birth. So usually clients have family planning only pregnancy related services for 9 to 10 months. Again, just depends on how that looks. Okay, another question is around when a client who is on family planning only pregnancy related and it's going to end, will they be notified of the family planning only program? Yes, they are. They are notified a little bit before, with enough time, I should say, ample time to apply for full scope Apple Health, or and if they're not eligible to apply for Apple Health for one reason or another, then they are, again, given the opportunity to apply for family planning only. So yes, again, that's something that's occurring now and will continue to happen. We are getting to the point where we need to wrap up. We're at 11:56. So there are a number of really great questions. There are some questions in here around what specific services are covered, around STD testing and treatment, what specific services are covered for contraception, what specific pieces. And so all of that information is currently available within our billing guide, our family planning billing guide. So when the follow-up communication comes out with the answers to the questions and answers that have been asked today, we will also include a link to the billing guide so that you can look through there and you can see those details. That's where it's detailed in full. Okay, I'm just looking to see. All right, so I greatly appreciate all of your input. I have led many webinars, and this has been by far the busiest a question box has ever been, which is fantastic and also a touch challenging to do both pieces at the same time. So again, I really appreciate your attentiveness today, your passion and interest in the topic of family planning and the Family Planning Only program. If there's anything else that Melissa or I can do for you, or you have additional questions after today's webinar ends, please feel free to send your questions, concerns, etc. to our family planning mailbox. Here at the Healthcare Authority, we will be welcoming a new family planning program manager within the next couple of months. And when that happens, she will be able to answer the questions out of this mailbox as well. And it will be a really good record as well as having to forward all the emails to that new person. So again, thank you so much for participating. If there's anything else we can do for you, please feel free to let us know. Have yourself a really great Friday and good rest of your weekend. Thank you, everybody. Goodbye.